Hi, everyone. Welcome to the Harmony Foundation podcast series. I'm pleased today to be joined with Rebecca Cranston and Samantha Borden with the Colorado Health Network. Welcome.
Thank you.
It's good to have you guys here today. We're very interested in learning more about the Colorado Health Network. Before we do that, let's talk a little bit about your backgrounds and how you both got into the field and working with HIV. You want to go first, Samantha?
Sure.
Okay.
So my journey into the HIV field started actually when I was 16 years old. A close friend of mine I came to find out, was living with HIV. And at the time, I had received little education around HIV. I had no idea that in the middle of Colorado, that was something that was still happening. And so I did what I usually do, and I read a lot of books, and I got involved, and eventually spent about 4 years volunteering at an ASO in the town that I went to college for my undergraduate degree in. And eventually, when I moved back to Colorado, I came over to Northern Colorado AIDS Project and was just I have always been super intrigued by the grassroots element involved in HIV advocacy, how much it affects so many different demographics, how passionate and how colorful and how strong the culture is. I'm also personally in recovery, and so our syringe access programming around HIV and Hep C prevention and harm reduction really hits home with me, and I'm very passionate about that as well.
Thank you. How about you, Rebecca?
Well, for me, it seems like a lot of the things that I'm passionate about kind of came together and converged, right? Because there's so much overlap in all these different communities that we're seeing. People who inject drugs, people with substance use issues, children in foster care, for example. So my personal background, I have substance use in my family, and I was a homeless teenager. I was also a trafficking survivor. And so, as I got older and became educated more and more about how all these various factors interplay in people's lives, I realized that, we really need to take a more holistic approach from a larger level. And at Colorado Health Network, NCAP, we do that. So HIV is just a part of that in terms of the stigma that people living with HIV face, but also people with substance use issues. And so, I think that's what brought me here. And now I'm trying to take that to the next level on a policy level as a candidate for Senate District 15,
nice.
Which encompasses most of Larimer County.
So really taking the advocacy to the next level.
Exactly.
That's fantastic.
Yeah.
So talk to me a little bit about what the Colorado Health Network does. I mean, people may hear that term, but it doesn't speak to HIV and AIDS. And so what does it mean? Sure.
Well, we started off as Colorado AIDS Project, and we actually are intentionally moving away from that branding, not to take away from the legacy of AIDS and the term, but now we find the term HIV to be more inclusive. And also we've also expanded our mission to include prevention services as well, which I'll let Sam go into a little bit more detail about, and also behavioral health services too. So we're really seeing, as I said, the overlap in all these things. And as HIV has changed as an illness throughout the years, we've really been able to be responsive to the new needs in the community as that shifts. For example, the proportion of transmission of HIV that is attributable to injection drug use has increased throughout the years. So as that's happened, we've been responsive with things like a syringe access program, behavioral health services for people who are not yet HIV positive, but who might be at risk. So to get back to the original question, I guess I'll start by talking about the services that we provide specifically to folks living with HIV, and our behavioral health services, and I'll let Sam talk about prevention. Okay. So for folks living with HIV, we do provide psychosocial services, so support for people to get together, to talk about what's going on in their lives, and to kind of integrate what it means to be living with HIV into their whole lives and their whole self. We also provide financial assistance, and that could look like rental and housing assistance, transportation assistance to and from appointments. We have a food bank for people. The idea is that we want to remove any barriers that would get in the way to somebody remaining virally suppressed. And that's for two reasons. The first is for individual health reasons. We obviously want people to fulfill their full potential in their life, and also for public health, because when people achieve viral suppression, they do not transmit HIV. So it's a public health reason that we are doing our part to make sure that HIV is less of a public health crisis.
That's
than it used to be.
fantastic. Thank you. And how about the prevention side, Sam?
So our prevention services also kind of are structured around that same mentality of being holistic, being client-centered, really meeting that person as an individual wherever they're at and whatever their particular need may be. So those kind of encompass rapid antibody HIV and hepatitis C testing, which we see co-occurring quite frequently. We also do our syringe access program, which provides new supplies to people who are injecting, as well as safe injection kits, harm reduction information, overdose prevention, training, and Narcan. We also do pre-exposure prophylaxis and non-occupational post-exposure prophylaxis support case management and general prevention case management, which allows us to facilitate folks getting into behavioral health services either in-house or out in the community. And then we provide outreach and education to our community as well. So these programs kind of just really reach to a lot of different communities that are affected by HIV or may be experiencing a higher incidence of HIV due to lack of resources, due to stigma in healthcare, due to different barriers. So we really try and reduce that and create a judgment-free environment for them.
Very comprehensive, and it sounds like you guys are really treating and working with a lot of pretty amazing people. So we certainly appreciate your work and your efforts that you're putting into it. This is your first time visiting Harmony?
Yes.
So what are your thoughts?
I think it's great. I really appreciate the staff's willingness to kind of work around different barriers that may exist for folks trying to get into treatment. It's such a beautiful area. We know that the mountains can be incredibly healing, and I appreciate that there's a lot of intent around utilizing the resources of kind of group therapy and communal living, because there's nothing better than finding a community of people who really know what you're going through and kind of speak to that experience when you're trying to bolster and start your journey of recovery.
Thank you. And so, Rebecca, our program is called Harmony Foundation. If somebody were to ask you, what does it mean to be in harmony? What does that mean to you?
Oh, that's an interesting question. I think I would say that there's an obvious mind, body, spirit component to being in harmony, and one other maybe additional leg I would add to that is being around nature, which you guys definitely have here, which I really appreciate. But I would say, making sure that all those are balanced and your body is healthy and you are feeling like you are achieving your goals in your life, and that you're also getting the spiritual fulfillment that you're seeking.
I like that. Thank you. So if someone wanted to access services at the Colorado Health Network, how could they get in touch with you?
They could call us. Our number is 970-484-4469. And they can just let us know where they're at, and we can get them routed into whatever service they want. They can also come and see us. We're located right near Old Town Fort Collins, or right in Old Town Fort Collins at 400 Remington Street. We also have an office in Greeley, and that's 2017 West 19th Avenue. And they're welcome to come see us there as well.
Do you have a website also?
We do.
Okay.
Our website is ncaids.org.
Wonderful. Well, thank you both for taking the time to visit with us. It was nice having you here.
Thank you so much.